The misconception I had was that people who needed health insurance were persons who really just didn't have the initiative to go out and find it, didn't really exert themselves to find jobs. I kind of looked down on them in a way. So when I suddenly found myself in that situation, it was like, oh no, I'm not supposed to be here. I'd never been in a situation where I had to come to anyone and ask for help. And that's what I felt like I was doing. But I needed it, and I'm glad I did.
I'm not trying to work the system. I'm trying just to pay my bills and take care of my family. I started working with Jimmy's about 15 years ago. I've had insurance ever since I've been here, up until when I turned 50. So the last 3 years, I've had no insurance. When I turned 50, my insurance went up to $1,000 a month. The employee here was going to pay half, and I'd have to pay half. But that's $125 a week out of a paycheck. And that's groceries. I just couldn't do it. Thank goodness for the free clinic, or I would be in so much trouble.
Many employers of our patients keep their hours limited to the extent that they do not qualify for benefits on their job. Many of our patients work several part-time jobs because it's the only way they can get enough income to survive. And of course, none of those jobs offer them benefits.
I had a patient that had a full-time job and health insurance. Her hours were cut back to part-time, so she lost her health insurance, so she couldn't afford a medication. Then she lost her job completely because she was not on her medication.
When you don't have money to pay for your medical care, you wait until something hurts. Often that's the point. They're having chest pain or they're having problems with their vision because they have diabetes and they've never had their diabetes treated, so now they're having that complication of diabetes.
Patients will frequently come to us who have put off any type of medical care, taking their medications to save money. Doing so keeps them in a kind of limbo state or below that, and they can't help their families. Once they can get their medications and count on them on a regular basis, they can enhance their family situation. They can assist in the home. They can return to work.
The identification and then the ongoing care for a chronically ill person is very important at the primary care level. That is where the problems are solved, not when we get them to the hospital because they have gone over the edge into diabetes or asthma or some other healthcare issue. That's where our health center treatment helps to stave that off.
I met a gentleman who was working for a bus company, and he had been feeling very ill, went to the hospital, was diagnosed with diabetes, had such high blood sugar that they automatically started him on insulin, which was appropriate, but you cannot be a bus driver and be on insulin. So he lost his job. He came to us without any insurance. We were able to get his blood sugars down, take him entirely off of insulin, and he was in the process last time I saw him of applying for more transportation positions. For someone that's all he's done for 25 years, it's really nice so that he can continue to be an active, employed citizen of Richmond.
Just last year, Virginia's healthcare safety net treated 233,000 uninsured Virginians. Every number represents a person. Most often they are hardworking, striving to take care of themselves and their families. They are not unmotivated. They are simply uninsured. Either their employers don't offer insurance, or, like Sandra Martin, when it's offered, they can't afford it. So their lives progress until something happens, an unexpected diagnosis of diabetes or hypertension or cancer. Then their fragile worlds start to fall apart, until the lucky ones find their local health safety net clinic or health center. That's where the magic happens. Lives are turned around when people obtain the health care they need. During the past 21 years, with your support, the Virginia Healthcare Foundation has helped expand the number of places where this magic occurs, from 33 to 183. Thank you for your partnership.